Hello, welcome to Empowered by Beauty. Marisa Faircloth, Lora Songster, and it just happens in life. Our skin gets tired, it sags, it droops,
I
and
hate it.
we
It
we we
does.
want lift. We
We
want
do.
to have the appearance that we used to have. And here at Restoration Med Spa, you have so many options for us.
We
Let's
do.
start with the soft wave.
Okay. So, absolutely, we want to tighten and lift. And I think the fallacy is that I can go to the drugstore and buy this magic cream, and all of a sudden my skin's going to be tight. Well, you will have better skin. You will have better nourished skin. But in order to really tighten the skin to get an appreciable lift, you got to do more. So we have multiple devices that can do this, multiple procedures. Softwave is a ultrasound device. We all know about ultrasound. It is not a laser. It is not breaking the skin. It is ultrasound that goes beneath the surface of the skin. And then when those ultrasound waves converge, they create heat. So we are creating that heat that stimulates collagen production. Like we talk about controlled thermal injury, we are controlling the circumstance and we are heating the level that we want to respond. So in this case, we're heating that collagen level so that we can start building more collagen and creating more tightening and elasticity of the skin. So soft wave's phenomenal. We can do soft wave anywhere. Now, of course, we do face, but we can do face, we can do neck, we can do chest. We have all kinds of aging that goes on there. We can do the inner arms, we can do the abdomen, we can do your butt, we can do knees. So Softwave is extremely versatile. It gives you some really good response. We do have to wait for your body to make collagen. There's nothing magic. So we aren't going to do it and you're going to walk out and it's all fixed. It takes a little time.
Sure.
Typically it's going to be 3 to 4 months before you start to see collagen improvement. So this is going to be a process. And depending upon the degree of laxity that you have, we might need to do 2 treatments. So you might wait a month or two and repeat that to even build more collagen. But with SoftWave, we have the ability not only to create collagen uniformly across the face, we have the ability to target where we build more collagen, and that might be if you have one eyebrow that's a little lower than the other, we can concentrate on this side and even that up. So we can lift the brow. We can tighten and lift the cheek area. We can tighten the jawline. So soft wave is a great modality for that.
And non-invasive because it's right on the top of your skin. Am I correct?
Right? Totally non invasive. We do not break the skin. There is no downtime. Now, for someone like you who's fair, we're putting heat in your skin. You might walk out looking like you just did a good workout and your skin's flushed, but that's heat.
Right.
That's going to dissipate in 30 minutes. You can go right back to work. You can do whatever you do. There is literally no downtime to it.
And would you say that's where a lot of people start, or does it just depend on the
So,
client?
if we're looking for skin tightening, I would say most people start lower than that. They start with things that probably aren't really skin tightening, they just think they are. You are not getting a lot of tightening and lift with anything less
Okay.
aggressive than soft wave. Doesn't mean there are not procedures out there. Things like microneedling. Microneedling is great for texture, so it is improving the exterior of the skin. But if you want that deep collagen, you need to get deeper and start doing some heat in that collagen level.
And I've seen the pamphlets for TriLift. Explain TriLift.
TriLift is really it's a revolutionary treatment. So we do a lot of things. You know that.
Yeah.
We do injectables, we do threads, we do a lot of procedures that are a little bit more invasive. And we also have that population of our clientele that does not ever want to do that. And that's okay. You know, we can get some lift and correction by adding some volume there, but if that patient does not want any kind of fillers, they don't want threads, TriLift is one of the next steps that we go to, because TriLift is using 3 different modalities. So we are using radio frequency, which is heat, kind of similar to what Softwave is doing with ultrasound. We're heating that collagen level to stimulate a little bit of collagen production that makes your skin thicker and tighter. But along with that, we're also creating muscle stimulation. So it's kind of like you're stimulating a muscle twitch.
Okay.
You know when you have a little bit of a muscle spasm and your eye twitches, it creates that twitch in these muscles that is tightening and lifting those muscles. So over time, all of the procedures that we've been doing are addressing your skin. That's great. But if you got a saggy muscle underneath your skin, it's not going to look as good as if you lift and tighten the muscle. We're working out your facial muscles. So think of it like working out your muscles. So while we're doing the radio frequency, we are inputting heat to stimulate collagen, but we're also stimulating that muscle so that it can tighten and lift. So we're really working out everything. We also add into that 2 radio frequency microneedling treatments. Again, more collagen production, so we're getting more heat down there that is really creating some nice tight skin, but it's also creating some surface correction, so it helps with textural issues. So if you have a little rough skin, it'll help it to be smoother. It refines your pores. It helps with fine lines and wrinkles. So this is giving you a minimally invasive option to a really nice lift and tightening. So we are able to do that without having to give you any real downtime. The radio frequency microneedling has, I'm going to say, hours of downtime. You might be a little bit red, and within hours, those channels are going to heal. For me, I'll do this at lunch, put on a little sunscreen, and I'm back to seeing patients. It is not enough to stop me from doing anything. Most patients are the same way. But at the worst case scenario, maybe you wait till tomorrow before you do something. The downside to this procedure is it is multiple procedures. So we're going to see you over the course of several weeks, once a week. And we're going to build on this. So some people are more likely to do something once a week that requires no real downtime. Other people are willing to give you downtime if they only have to come in once. So TriLift is our answer for the people who are willing to come in more and want to see a slow, gradual change, but don't want to be inconvenienced with downtime. We then have a more aggressive treatment called eye laser.
Eye laser, as in eye or the letter
as
I?
in the letter I,
Okay.
like iPhone.
Okay.
So eye laser. An eye laser can do multiple things. The main thing, what we're talking about today, is tightening. So eye laser uses a probe that we insert under the skin. So it is minimally invasive. We make a little tiny hole with a needle. We thread that probe under the skin, and then it's a laser that fires and tightens internally. So you're getting a lot more tightening than some of the external ones because we're creating a lot more heat deep in that tissue. It is minimally invasive. You're awake. You don't have to have any type of external anesthesia. We're going to inject you with an anesthetic so you don't feel anything, but you don't have to be put to sleep or anything like that. Now, you do have a little bit more recovery. You're going to have some swelling. You potentially could have some bruising, so you need to be prepared that at least for a few days and ideally a week, you don't have anything big coming up so that you don't plan to do something that you want to make sure that you don't have any swelling or anything for. But now we're getting results that are potentially mimicking a mini facelift.
Wow.
Without any type of surgical intervention.
Now, you said a few days, 2, 3, 4 days. Let's say I don't have much vacation time. Let's say, okay, am I going to look crazy if I go back to work the next day? Is it something I can put powder over? What is the protocol for that?
So, ideally, we want you to have a minimum of 4 days.
Okay.
Because we're going to want you to wear a compression dressing. That's going to prevent the swelling and it's going to improve your recovery. So I would prefer that if you choose to do eye lift, you're going to say, I'm willing to do it on a Thursday and not go back to work until maybe Tuesday. Give me a few days that you have some good recovery. We could shorten that slightly, but it is going to mean you take longer to recover. So that's where we make the choice of what's appropriate for you. If you're going to tell me, I'm not doing that, you know, I'm going to go back to work. I can do it on a Friday, and I'm going to work on Monday, and I'm going to work like nothing happened. You're going to be a way better candidate for TriLift because we aren't doing anything invasive that you need recovery for. You are going to need time for your visit, but you aren't going to need time away from work other than your visit. With the eye laser, I think you should. You need to recover correctly to get your best outcome. And if you're going to invest in a procedure to get good outcome, we want you to invest in the recovery.
Of course, that makes perfect sense. And you have all these options available to people. And once again, you come in for your consultation. And it is kind of overwhelming. And you think, okay, this is good. What is the difference in the duration of efficacy from the soft wave to the TriLift to the eye laser?
That's a hard question.
Okay.
Because it depends on the patient.
Okay.
You know, it depends on your start point and what we're trying to accomplish. So if I have a patient who comes in and they're 30 and they want to build their collagen bank and they want to prevent getting a lot of early wrinkles and damage, and they decide to do a soft wave, that result's going to last a lot longer on them than if you're
me
65, 70, and we're expecting that to repair and hold. Because we are repairing, but we aren't stopping time, we aren't stopping aging, we aren't stopping sun damage and environmental factors. So that is going to look different for different people. On average, I'm going to say that soft wave and TriLift are some of the procedures that we expect will probably last a couple of years.
That's fantastic.
Eye laser, potentially even longer than that. But it also depends on who we're treating and what they look like when we start. I'm always of the mindset, I don't want you to wait until you see the results go away. You know, it's kind of like my hair. I would love not to even acknowledge that I have roots.
Mm-hmm.
And I don't want to see them. So I want to treat it before it's readily apparent. Right. So I don't want to go into my hairstylist with 1.5 inches of roots where everyone can see that I have roots. My goal is that you miraculously think that my hair is natural.
Well, of course. What else would we think?
This is just the way I look all the time. But that's also our goal for our patient. Our goal is that we improve your skin situation and the tightness and the lift, and then we never let that go away. So we always want to treat it before it goes away. So especially with something like TriLift, that's a series, my goal would be do the series, get the outcome, but then don't wait 3 years to do the series. What I did the TriLift series about a year ago. My son got married in April, and I did the series prior to that. I liked the outcome. I don't want to see what my before picture looked like. I don't want that to come back. So I will intermittently do something. Like I might throw in a muscle stimulation treatment, or every 6 months I'll do a radio frequency microneedling. Maybe I never need to do the whole series back to back again. I would love that to be the case, but it depends on how quickly you're aging to how much you need to do to prevent that result from going away.
And with these devices, we've talked about skin inclusivity and different melanin in the skin, and again, is this an individualized course of action based on your pigmentation?
It could be. Fortunately, all 3 of these treatments are perfectly fine for all skin types. So with the soft wave, we're putting heat beneath the melanin level, so we're not impacting that. With TriLift, we're not breaking the skin or doing anything that would create a problem, except for with the radio frequency microneedling, and that also is putting the heat beneath the melanin level. With the eye laser, we're also going deeper. So all of these are actually safer than laser treatments that are more superficial.
That's very interesting. That the very thought that you could have facelift kind of results without.
It's exciting.
It's very exciting, and I'm sure it's an investment. And we haven't talked about this much, Marisa, but if you want something and you think I really want it, right now my bank account isn't where I want it to be, or my tax refund hasn't come in yet, and I've earmarked that money. There are options.
There are options. We have multiple options. Now, of course, many patients come in and they're willing to pay up front for their procedure. And have other patients who are in the same circumstance that you're talking about. We offer multiple financing options that may give you a free period. Maybe just giving you 6 months to break up your payments over a 6-month period of time, or sometimes even a year, depending upon the financing companies that we use. We invest in those options for you. So we pay that interest so that you have a longer time span to pay it off. And sometimes it makes the difference of whether or not you can do it. You may choose to save up and come in, but you might not be able to put off your son's wedding and you want it prior. So if you can break it up into multiple payments, that's a viable option for us. Again, we use a lot of financing sources that many people come in, they already have. if you've been to the vet and you have care credit from your dog who had to have emergency surgery, we take care credit. We can utilize that. If you want to work with something like Alipay, Allergan is the manufacturer of Botox and filler, and they have their own program. But we probably have 4 different sources that we use. So we do have a lot of options to help you make it a little bit easier.
Well, and I think it's also important to say that you not only give the options, but you explain. Because with any kind of payment, there's interest, and you want to make sure, once again, that you are a good steward of your client's money. And giving them options, that's one way to do it. And I think that's wonderful.
And we do explain it because you're right. 6 months interest free means it needs to be paid off in 6
Right.
months. So if you're telling me you want to finance a $1,200 procedure and you can only afford $100 a month, that's not a good option for you, because once that free period ends, you are going to have interest. And frankly, that particular kind of program is going to have a much higher interest rate
Right.
than if you go with a different finance company that you just break it up in payments and pay a little bit of interest. So we offer all of those. And just like treatment plans, the same financing isn't great for everybody. So we do have probably 4 different options that we can use, and we'll find the one that suits you the best.
And once again, when you're in the room with whether it's you or one of the other providers, it's very transparent. If we do this, you're looking at this amount. We could do this and it'll be this amount. We can do this in several stages, and you're letting people know ahead of time. This is what it's going to be. Think about it, and let's come up with a plan together, which yields very, very happy clients.
Well, and every plan is different. You may have an event that this is when the event is. I need to know that I'm going to get my optimum outcome by then. And different procedures work differently. Some of them we do one procedure and we know it's going to take this amount of time to see your best outcome. Other ones take a little bit longer. So we want to customize that to suit your timeline too, not just what you're willing to give us as far as recovery, but what kind of timeline do we have, and what kind of skin do you have? Is this appropriate for you? Is this more appropriate for you? Which one is better for your budget? There's a lot of times that we come in and we say, this is really what's best for what you're looking for. But if we can't do that, this is a good option that's going to get you partway to your goal and at least give us something to build on.
There's always a conversation and an education, which is so important when you're talking about your face and your body.
Absolutely, and you just have to start somewhere.
Starting somewhere, and this is the best place to do it, Restoration Med Spa. Marisa Faircloth, it is Empowered by Beauty. I'm Lora Songster. Join us again.